Good evening. I'm Dr. Judith Currier from the class of 1979, professor of medicine and chief of the Division of Infectious Diseases at UCLA. And I'm so honored to join you tonight with our conversation with Dr. Anthony Fauci. Before I introduce Dr. Fauci, I wanted to invite you to submit questions using the Q&A button in the bottom of your Zoom screen. We'll incorporate your questions as we move through our conversation, but given the number of questions, we may not be able to answer them all. So, after everything that has happened in this past year plus of COVID-19, it's hard to imagine a person who needs an introduction less than Dr. Anthony Fauci. A graduate of Holy Cross and Cornell Medical School, Dr. Fauci began his career at the National Institutes of Health as an infectious disease researcher, where he was appointed the director in 1984. He has a long and storied career at the highest levels of biomedical research and public health in our country. Before there was COVID-19, he dealt with on our nation's behalf with viral epidemics like SARS and bird flu, swine flu, Zika, and Ebola. And 40 years ago, in June of 1981, when the first reports were published by CDC of a mysterious new illness that would go on to be known as HIV and AIDS, Dr. Fauci immediately understood the severity of the crisis and took action in his laboratory, in the clinic, and working on public policy. As a physician and researcher working in AIDS for the past 30 years myself, I've had the privilege of working with Dr. Fauci in my role in the AIDS Clinical Trials Group. This is a network of sites around the world dedicated to finding treatments for HIV and related complications that Dr. Fauci started. So while he was already known for this earlier work, it was his public role on the coronavirus task force in the prior administration that put him squarely at the front of today's American public. With that role and all of its drama came an unlikely leap from infectious disease expert to pop culture icon, and Dr. Fauci is now everywhere. On bumper stickers, on bobbleheads and t-shirts with the slogan, "In Fauci we trust," on coffee mugs with the line, "Keep calm and wash your hands," a variety of pandemic-themed cocktails sold in little sacks, like the adult version of Capri Suns, are called Fauci Pouchies, and COVID vaccines are called Fauci Ouchies. But more importantly, Dr. Fauci has become, in a symbol of our divided politics, both a national hero and voice of reason to many, and a lightning rod to others. But throughout it all, he's maintained his professionalism and cool. Among the many, many awards that he's received is the Presidential Medal of Honor. And today, Dr. Fauci remains hard at work, still seeing patients and continuing to serve as the director of the National Institutes of Allergy and Infectious Disease, and as the chief medical officer advisor to President Joseph Biden. Dr. Fauci, congratulations on your honorary degree from Bowdoin and for being here with us tonight. We're thrilled to welcome you to the Bowdoin family.
Thank you so much, Judy. It's great to be here with you. Thank you.
Now, I do happen to know that throughout your life, you've been an avid runner, and I suspect that this has helped to prepare you for the marathon that you've been running over the last year and a half. So before we start our chat tonight, I'd like to invite a dear friend and fellow class member from the class of 79 here at Bowdoin, who knows a little something about resilience and marathons, who's going to share a special token of our appreciation, and we'll throw out the first question. Joan Benoit Samuelson requires no introduction to the Bowdoin family. She's an elite marathoner who's has run sub-3-hour marathons in 5 different decades and won the first women's Olympic marathon in Los Angeles in 1984. She is someone who inspires us all to harness our passion and make a difference in the world. Joni, thanks for joining us tonight.
Thank you, Dr. Judy. It's my distinct honor to have you introduce me and for me to have an opportunity to introduce Dr. Fauci to the Bowdoin community. You did a wonderful job introducing him, and Dr. Fauci, I'd just like to say thank you from all of us. You are truly the endurance athlete of the night, and we're just so honored that you have accepted this honorary degree from our dear alma mater. And as you can see, we are going to present you tonight with a Bowdoin singlet. I was a Bowdoin student when I ran my first marathon, my first Boston Marathon in 1979. And I still have that singlet, which will be in the warm hands of the college very soon. But we want you to have your very own, and it's your pace, not mine, that'll carry us through this pandemic. So I just want to thank you so, so much for your grit and your endurance and your resilience, because you have a few years on me. And I don't know how you do it, but you're doing it, and we're all so grateful. So thank you very, very much. And I just guess I'm supposed to ask you the first question. And my question is, it seems like you're working 70+ hours every day. I'm wondering where you're finding time to run. And I also want to know when you're going to take a vacation. And you understand that Maine is vacation land. So we're guessing you're going to take a vacation in Maine. And we're just wondering where you might choose to take that vacation in Maine. Thank you so much.
Well, thank you, Joan. It's really a pleasure and an honor to be on this same fireside chat with you. I've been an admirer of you from way back when you were in the prime of your performances, and I've always admired them. So really, it's my pleasure and my honor to meet you. Thank you for being here. You know, I used to run, I'm at the NIH in Bethesda, Maryland, and for years and years, I would, instead of eating lunch, I would just go out and run through the parks during the day. And it was really refreshing for me and would just keep me focused on the work that I was doing. But now, given my schedule is so completely crazy, what I do is I get the opportunity at night when I run in the evenings. So I don't run, as I said, I power walk, but I don't do it during the day. The only time I do it during the day is on the weekends when my wife and I go to the C&O Canal along the Potomac River, which is an absolutely beautiful spot to either run or power walk with all the birds and all the animals around. So that's where I really get my relief of my stress and my tension. Still, after all these years, it has to do with maybe not running, but at least walking very fast. And I will take a vacation, Joan. I'm not sure I'll get to Maine, but maybe, but I will take a vacation when we get this level of infection down to a low enough level when I can feel confident that it's really going to stay down and not rebound back. So hopefully that will be reasonably soon. I think it will.
Well, we all hope that it'll be very soon, and you know you're warmly welcomed into our great state and also into the heart of our college community. So thank you, and find that time, doctor, because it's all about balance in one's life. Mind, body, spirit.
I got it, Joan. Thank you.
Thank you very much.
Thanks, Joni. Okay, so now let's move into our conversation. I think it would be good to just start by, let's take stock of where we are today. We have over 164 million cases of COVID-19 worldwide and 3.5 million deaths, and maybe over 1.5 billion people have been vaccinated. So what makes you optimistic at this point, and what keeps you up at night?
Well, I'm optimistic about the countries that have vaccine and are administering the vaccine, because Judy, this, as you know, we are very fortunate to have a highly, highly effective vaccine, not only against protecting against infection, but even against the variants. It works because of the cushion effect of spillover protection. The challenge that we have and that bothers me, and as you say, if you want to say keeps me up at night, is that we have a real challenge and a mission to get the rest of the world vaccinated. We're doing very well right now. As of 2 days ago, Judy, we have 60% of the adult population having received at least one dose of vaccine. And if we get to the president's goal, which I believe we will, by July 4th, we'll have at least 70% of the adult population having received one dose. My concern is that it's a global pandemic and it requires a global response. And there has been attempts to some success in trying to get a more equitable distribution of vaccines, but we've got to do much, much better than that. We've got to mobilize the vaccine production capability of the world so that we don't have a 2 to 3 year lag before people in low and middle income countries get vaccinated, because that will literally mean 1 million deaths if we wait that long, and maybe more, and that's unacceptable. So we've got to figure out a way how we take care of our own country, which we have a responsibility to do, but that we join with some of the other more wealthy countries, like countries in the EU and UK and Australia and Canada and others, to be able to get those plants that are making vaccines revved up to make billions of more doses. So what keeps me up at night is the fact that we might fail to do that. And if we do, then more people will die.
I think that's a critically important issue. And, in this country, it's great to see the vaccines, being adapted and rolled out, but there still is some vaccine hesitancy. And it's interesting that one thing that worries people about the vaccine is how fast it was developed. But can you just put into perspective what an amazing accomplishment it was to get multiple vaccines in really less than a year?
Yeah, Judy, that is the most commonly asked question in the context of hesitancy. When people say, how could it possibly be that you've been telling us and others have been saying over the years that it takes multiple years from the time you identify a new pathogen to the time you have a vaccine that's been tested and proved to be safe and effective? We knew the sequence of COVID-19, of SARS-CoV-2, in the first week of January of 2020. And by December of 2020, we were putting doses into people's arms of a highly efficacious and now effective vaccine. What people don't fully appreciate, which I actually try to summarize in an editorial I wrote in Science a week and a half ago, is that this is a reflection of the decades, literally decades long investment in biomedical research. From the mRNA work that started off as a basic science project to be able to fashion that molecule so that it doesn't trigger an inflammatory response, so it could be used as a vaccine, to the interesting thing that you and I are very familiar with, which is a great story, Judy. It's that how the structure-based vaccine design that we've all been doing with HIV, trying to get the HIV envelope at the right conformation so that it would bind to and induce broadly neutralizing antibodies, that same structure-based vaccine design was taught by the HIV people to the people in the Vaccine Research Center, namely Barney Graham, who was mostly interested in RSV, respiratory syncytial virus, showed how to get the prefusion conformation of this spike protein and get it in the form where it's stabilized and not floppy by making a few key mutations. That was the relationship between HIV research and COVID-19 research. So now we have an extremely effective immunogen. So the bottom line is, when people say it took too long, too short, you must have rushed it. We didn't rush it. It was years, literally decades of research, basic biomedical and clinical research.
Right, it was and all the right pieces put together right at the right time. And it's so exciting that we now have mRNA vaccines that are been demonstrated to work. Do you think this is going to jumpstart vaccines in other areas now?
Absolutely, it's already started. We're already seeing people who are using the mRNA technology to actually develop new generation of vaccines for HIV, for tuberculosis, for malaria. I believe it's going to really transform the field. And I believe that and even the cancer field of cancer immunology, the mRNA technology is now looked upon with a considerable degree of excitement.
So these investments in basic science research really, really do pay off over and over. It's also notable to me that several of the large teams developing the vaccines, both at the Vaccine Research Center at NIH and at Pfizer and in Oxford, were led or had key leaders who were women. Do you think we're making progress in diversifying the workforce in biomedical research? And what do you think we can do to continue to see more diversity in the researchers?
Well, you're absolutely right. When you look at the mRNA, Katie Carrico with the BioNTech, Kizzy Corbett at the NIH, and others is, yes, clearly, well, not only seeing an successful attempt at more diversity in the biomedical research field, but we're seeing how incredibly successful these women are. So, I mean, if there's any proof of the fact that we really do need more diversity, particularly getting women the opportunity to be in leadership positions, and I'm very excited about that. Unfortunately, we're losing Kizzy Corbett to Harvard, as you might expect. In a government salary and a government resources, you can't keep up with it, but that's great. I think she's going to have an incredibly productive career there, and I wish her all the best.
That's great. So there are several questions about vaccines and when we might know if we're going to need boosters and how that information will sort of, what are we waiting for? Results of a particular study to start to see people lose immunity? What do you think the time frame is for thinking about boosters?
Well, we're already considering that we likely within a period of a year or so will have to boost people. In general, the durability of protection against coronaviruses is not in the ballpark of, let's say, measles vaccines at all by any means. So there are two things that one looks at. We know that there's a certain cutoff point of correlation of immunity, the clinical correlates that we talk about. And right now, fortunately for us, the mean response of people who get a good response is multifold above the baseline that you need. So if the baseline is here and you're up here, you just follow people a period of time as you see it come down and approach the baseline beneath which you don't get good protection, plus the clinical observation of getting more breakthrough infections will trigger us starting to give boosters. The thing that we find very encouraging, Judy, is that the level of antibody response against the wild type virus, when you have like a 1 to 2,000 titer and all you need is a 1 to 100 or 1 to 200, and you deal with the variants, you get reasonably good protection against the variants. Even though you diminish the capability by 2, 3, 4-fold, you still have enough cushion effect to protect against the variants, particularly against severe disease leading to hospitalizations and death. So it is conceivable, and I think more likely than not, that when you boost with the wild type, you will elevate your levels high enough that you'll cover the variants also. So instead of having to play whack-a-mole with each individual variant and develop a booster that's variant specific, it is likely that you could just keep boosting against the wild type and wind up getting a good enough response that you wouldn't have to worry about the variants.
That's really encouraging, and I hope that turns out to be the case. It will certainly help us through the next year. So with this kind of race that we're having now with the variants, trying to vaccinate ahead of the variants and get ahead of this, we still do have our public health measures, which have been so critical in stemming the tide against COVID. And the hot topic for this week is masks once again. And it just appears that, one size doesn't fit all, both for wearing them and for policy. So how do you kind of approach this? What advice do you have for people who are trying to weigh when they should and shouldn't wear a mask?
Well, that's a seemingly simple question with a complicated answer. And that is that we know now from the real world effectiveness data, both in the large number of follow-up studies, what I mentioned to you about protection against variants, but also that more and more data comes in, indicates that if you are vaccinated and you have a breakthrough infection, the chances are overwhelming that it will be asymptomatic, and the level of virus in your nasopharynx would be quite low, indicating that even if you have a breakthrough infection, it's unlikely that you're going to transmit it to somebody else. Those three things, Judy, prompted the CDC to say, we have enough data to feel confident now that if you are fully vaccinated, you really don't need to wear a mask, not only outdoors, but even indoors. And that's a big change, because just a little while ago, they were saying, okay, with outdoors, but indoors, you still have to wear it if there's people that you don't know, people who are from different households, et cetera. That's changed. The issue that's come up is now that's created some confusion, because that has maybe been interpreted as you don't need to wear a mask anymore. No, not at all. That was only referring to people who are fully vaccinated. People who are not vaccinated yet are really at risk, particularly if you're living in an area in which the viral dynamics and the amount of infections in the particular area you're living, whether it be at a county, a city, or a state, or what have you, that it really is very risky not to wear a mask if you are not vaccinated. And then there's the issue of establishment. So someone says, okay, I own an establishment, a store, or what have you. I don't know if you're vaccinated or not. There's no vaccine passports. And people are not going to be telling you, maybe honestly, whether they're vaccinated or not. So you could have a shop, a store, what have you, where there are going to be people coming in. Some are vaccinated, some are not. Some might be infected, and some might be really vulnerable to infection. So what do? You say, well, since the CDC said you don't have to wear a mask when you're indoors, I'm not going to give a mask mandate. A lot of people are saying no, since I don't know whether you're vaccinated or not, and since there's a lot of infection around, if you want to come into my establishment, you have to wear a mask. So that's, I think, the thing that we need to clarify, which I'm trying now, because people really get confused about that. And there will be situations where no matter what you say about being vaccinated, you still would have to wear a mask. That's on public transportation, airplanes, trains, et cetera. So even though the guidelines say you can feel safe that you won't get infected indoors and outdoors, there will be situations where you will have to wear a mask.
Yeah, definitely one size does not fit all. And certainly people who have had organ transplants or immunosuppressed for other reasons where we're concerned the vaccine might not be quite as effective also need to take extra precautions. And there's some questions in the Q&A too about families where some of the people have been vaccinated and the younger children haven't been able to be vaccinated yet, and how they, when they go out, how they manage this. You have to wear a mask, but you don't, with their kids.
Yeah, that gets complicated. There's some things that are clear, that if you're vaccinated and your children are not, in the confines of your home and in your family environment, absolutely the children don't have to wear masks. And certainly you don't have to wear a mask. It gets a little tricky when you go outside and the kids are interacting with families indoors, playing with people who might not be vaccinated and who in fact might be infected. So under those circumstances, you want the children to wear a mask. I know that sort of gets complicated because you say, well, kids are not going to wind up getting seriously infected, seriously ill when they get infected. but that's not always the case. So you really got to be careful. And that's one of the reasons why the CDC still recommends that under those circumstances, kids wear masks.
Yeah, and I think the fine print, or the not so fine print, the print in the CDC recommendations really does have a lot of detail, and hopefully people will read those carefully, because I think they do provide the guidance that we're all looking for, but it's not one size fits all. There's several questions here about sort of preparing for future pandemics, and one specifically around the interaction between the animal world and the human world, the so-called One Health, and how climate change and other things are impacting, different animal species and leading to new pathogens emerging. I guess the question is, what should we be doing to be prepared for the next pandemic?
Well, you mentioned the animal-human interface. That's one of the things that I think we really need to address. I mean, I know there are traditions and customs in different parts of the world that would be very difficult to change, but the whole idea of wet markets where people bring in animals in from the wild could be infected with any of a number of pathogens, usually viruses, and the human interface there where they see these animals, they touch them, they clean them, the animals are alive when they come in. We know from SARS-CoV-1 that it was a bat to a civet cat to a human. In MERS, it was a bat to a camel to a human. We don't know quite yet what happened with COVID-19, but certainly the human-animal interface is a risky proposition. And I think there needs to be some universal global regulation of that. I really do. I know that's tough because you're encroaching upon the customs and the traditions of some countries, but enough is enough with this, with what we've seen historically. Then there's the other things, you prepare from a public health standpoint. We want to have the global health security network. We've got to continue to strengthen that. There's got to be transparencies. There's got to be a good surveillance system globally. We've got to have testing available. But the thing that I keep emphasizing, the one success story of this entire outbreak is the fruits of biomedical research. The fact that we were able to get a vaccine so quickly, so effectively, and so safely. So I think one of the major components of preparing for pandemics that we should not ever forget is the continued investment in basic and clinical biomedical research.
Are there other things that you learned dealing with HIV, in addition to the investment in biomedical research, that have been helpful in dealing with the COVID-19 pandemic? Well,
yeah, I don't know if it's been helpful in a practical sense, but it's striking how both HIV and COVID-19 shine a very bright light on health disparities. In our own country, in the United States, the numbers as well or better than anyone, that we have 13% of the population is African American and 44% of the new infections are among African Americans. Of those, 65% are men who have sex with men. 75% of those are young Black men who have sex with men. So there's a striking health disparity. We're seeing the same exact thing with COVID-19. The jobs that brown and Black people find themselves in as essential workers in society give them a greater likelihood that they're going to get infected. And the inherent decades-long social determinants of health, which renders them susceptible to diabetes, hypertension, chronic renal disease, obesity, all those kinds of things, make it more likely that when a brown or Black person does get infected, that in fact they'll have a more severe outcome. So those are stark and striking similarities. The other thing that is always a situation, is the stigma and the discrimination associated with it. We see that in all the diseases that we deal with, which is unfortunate.
Yeah, and I think that really working with the community was really something that you took right to heart at the beginning of the HIV pandemic. The importance of community voices being at the table as we think about how we approach this disease. Do you feel like that's happening with COVID?
Yeah, it's an extraordinarily important issue. And you're right. The success that we had when we embraced the activist community to make sure that when we designed clinical trials, we did it in a user-friendly manner, that the regulatory function was not overly restricted in an inappropriate way. Right now, equity is critical. We've got to get the vaccines distributed in an equitable manner. And what the Biden administration has put together, which I think really is a good idea and is working, is what's called a COVID-19 community core, where you get trusted members of the community and you give them all the necessary information that they need to go out and convince people who are somewhat hesitant to be vaccinated to get vaccinated. And you do that by embracing, for example, sports heroes, entertainers, clergy, and even your own family doctor, because a lot of the hesitancy when you sit down and explain and ask people in a non-judgmental way why they are hesitant, they come up with obviously good questions. If you can answer the questions to their satisfaction, you can win a lot more people over to getting vaccinated.
It's so important. There are several questions in the chat about this critical nature of global vaccine distribution and what we need to be doing differently as a world to develop vaccines so that they can be produced and delivered around the globe. Can you just share some of your thoughts on the current sort of financial models that underlie or underpin vaccine development and how we need to potentially change the formula to make a global vaccine something we all share in producing?
Yeah, well, first of all, let me just state the fundamental principle that, I stated many years ago when we put together the PEPFAR program, that I believe that, wealthy nations like the United States really do have a moral responsibility to be able to assist low and middle income countries that don't have the resources to get interventions that would be life-saving when you easily get it when you're in a rich country. It applied to HIV, which is the reason why we developed the Global Fund and PEPFAR, and it applies to COVID-19, which is the reason why we really need to create a system, and I don't think it's going to be that difficult, where you not only manufacture doses of vaccine that you could distribute to low and middle income countries, but that you provide the technology transfer to allow low and middle income countries to essentially make vaccines for themselves, so they don't have to rely on the rich countries to continually giving them doses, that they could have plants and factories that make the doses, and that the technology is transferred to them so that they could make it. And that could mean plants in Senegal or Ethiopia or South Africa, South America, or what have you. So it's more than just giving away doses, it's providing the capability of countries to make their own doses.
I think that's an excellent point. Much like the way that antiretroviral therapy is made in other countries like Brazil
Right.
to this day. I think that's a really terrific model for this. So we could talk about the science all night, and we might still, but there's so many questions here about just sort of your personal journey over the past year. And maybe just a little bit generally, there was a lot of anti-science sentiment. How do we address that as a nation and from an educational institution, college, Bowdoin College, what can we do to address the anti-science sentiment that seems to have been pervasive in many parts of the country.
Yeah, Judy, that is a very difficult situation to address. It really is, because it is accompanied by, in my mind, a really scary trend in this country. Not only anti-science, but look at the number of people who have an outright abject denial of reality. I'm not a political person. As you know, I've served 7 presidents of different stripes and different ideologies: Republican, Democrat, liberal, moderate, conservative, radical, whatever, all of them. So I don't want to get into the political sphere, but part of the anti-science is the alternative facts situation that we had to face for some time, where people deny things that are staring them right in the face. Where you had situations where hospitals were running out of ICU beds, and people in that area were denying the fact that COVID-19 is a problem. So it goes deeper than just anti-science. It's almost it's a distortion of what reality is. That is really very scary. And we're seeing that right now in our society, and that really is troubling. I don't know how we can change that. I just don't.
Just keep talking about the facts and showing the evidence.
Right. That's the only weapon we have, is the facts. And hopefully when people see the facts, they'll accept the facts. But unfortunately, that isn't always the case.
Yeah, well, you've certainly, many of the people, the questions in the chat are really acknowledging and thanking you for your leadership and for being steadfast during this time. And several of the questioners are, asking, how did you do it? How did you keep your cool, and how did you just stay focused on the cause during this whole time that must have been so overwhelming in so many ways?
Well, Judy, I don't know. It's just, built into who I am, and my fundamental personality and my character is that I've always had the capability of focusing. We focused on things in medical school. We focused in things during our training and internship and residency, and we focus on what we do in our own research. You just have to turn that focus knob up a lot more and say, with all of the noise and all of the craziness, the way you get through it is just focus on the enormity of the task and what's at stake, that you're dealing with a global pandemic, the likes of which we have not seen in 102 years. Just keep that in your mind and don't get distracted by all of the other stuff, which sometimes can seem completely crazy, and it really is. But if you get sucked up in it, you get distracted, you get anxious about it, and you let it influence your thinking. You have to just say, that's nonsense, and I'm just going to focus on what we need to do.
It sounds like good advice. For your fellow classmates in the class of 2021 graduating from Bowdoin, what advice do you have for them about finding your path in the world, and maybe some of your career highlights and things that have influenced you to make the decisions you did about how you spend your time?
Well, one of the things or more than one of the things that I always emphasize when I think back at what drove me and got me to where I am right now, is that you have to pick out something that you're really passionate about. And that's something that you are passionate about, not what other people would like you to do or what people expect you to do, but something that you yourself feel that you can be passionate about, you can put all your energy into. And that's going to differ for different people. And you only need to worry about what works for you. So that's one of the bits of advice. The other thing that for me has been truly highly influential in my career is to keep an open mind and expect the unexpected. Because I am where I am now is nowhere near what I thought I would be when I graduated from medical school, and certain things pop up in the world around you. And if you sense that you might be able to pursue that path, take a chance and do it. You know, that's exactly what happened to me when I first got involved with HIV/AIDS back in the summer of 1981, very soon after the first cases of this brand new mysterious disease was reported. I had been involved in a trajectory of a very successful career doing something else. And I made a decision that this looks like it's going to be big. So I'm going to turn around the direction of my career and pursue this mysterious and frightening disease. Had I listened to my mentors who were saying, don't do that, that's a diversion away from a very successful career, I likely would not be where I am right now. So for my advice, if you want to call it that, I don't like to say advice because it seems like you know a lot more than other people when maybe you don't. But my encouragement rather than advice for the Bowdoin graduates is to do just that. Pick out what you're passionate about and pursue it, and expect the unexpected and be flexible enough to follow these unanticipated opportunities that all of a sudden fall in front of you.
It sounds like good advice. You know, certainly throughout your career at NIH, you've probably had lots of opportunities to leave and to go and do other things, but you've stayed as a public servant throughout your life. What keeps you there? And you know, I think that just looking, you know, I'm in my 60s and I'm wondering like how much longer I'm going to work. And I look at you and I think he's been at the top of his career for, you know, over 40 years and he just keeps going. What keeps you going like that? And what advice or what is it about your job that you love so much?
Well, it's the importance and the potential impact of it, Judy. It's the excitement of it, something that I know you know and are familiar with, the excitement of discovery, the excitement of doing something that's going to have a positive impact in a broad way on the health of people, not only in your own country, but throughout the world. And being in science right now is just so exciting. I mean, the technological advances that have allowed us to do things now that we couldn't do years ago, you know, is just, you know, gasoline to the engine, as it were, to keep you going. I don't even think about stopping right now because there's so many challenges ahead. You know, we're gonna put COVID-19 in the rear view mirror. We're gonna crush it. I'm sure we can. And when we do, you know, we have other things that you and I are interested in, like getting a vaccine for HIV or getting better therapies, perhaps even a cure. And then there are other diseases that I think we can utilize the technologies that we've learned through COVID-19 for things like malaria and tuberculosis. There's so much to do. And that's really the incentive that keeps you focusing on why you want to stay and keep doing things that you can do, so long as you're still on the top of your game. You know, I mean, and that's the point. I mean, and I am a pretty good gauge about whether I'm going on all cylinders. And my wife is an incredibly honest person with me. And by the way, yesterday was our 36th anniversary, which is terrific. But she'll let me know when she thinks I'm slowing down a little bit. So I'll rely on that.
I don't think there's any sign of that at all. And that it is exciting to think of all the work that's yet to be done. And I do hope that COVID has inspired people who maybe previously didn't consider working in the fields of public health and biomedical research to take a look, because it is never too late to start something new. So there's several questions here, kind of getting back to the COVID situation a little bit about when do you think when do you think foreign travel outside the US will resume? When should people be, and obviously it depends on where you're planning to go, but when do you think that will start to pick up again?
I can't guarantee anything, Judy, but what I really do think it's going to be some time as we get into the summer and early fall. Already we're hearing about the European Union trying to relax some of the restrictions about people coming in from the United States. And I think as our vaccination rate gets up above 70%, and as the level of infection goes down considerably, I think you're going to see a lot of countries opening up to allow Americans to come into their country. And I think it's going to be vice versa with us and other countries. I hope that by the time we get to the middle end of the summer and into the early fall, we'll see a lot more travel internationally.
So there's a few questions. People are marveling at your background and all of the interesting pieces of artifacts behind you. This is perhaps my favorite question of the night, about as a kid growing up in Brooklyn in the 50s, how did you adjust to the Dodgers leaving to the West Coast?
Well, I have to tell you, I was very upset by it, but what people don't fully realize, the New Yorkers will know that kids in Brooklyn were almost equally divided between being New York Yankee fans and Brooklyn Dodger fans, even though they lived in Brooklyn, because it was amazing. You had one city, New York City, that had three very good baseball teams, the New York Giants, the New York Yankees, and the Brooklyn Dodgers. I was a Yankee fan, even though I lived in Brooklyn. And we used to have a lot of fun, arguing which player was better at what position. But we all were disturbed. Even the Yankee fans were disturbed when the Brooklyn Dodgers left to go to Los Angeles. But it certainly has done a lot for the city of Los Angeles. You've won a couple of championships, so.
Yes, and they have, and they have a few Red Sox players too now. So other questions about there's been so much positive that's come from your career in public health and infectious disease. Are there downsides, or the things that you would recommend or have people think about before choosing to work in this kind of area?
I don't think so. I mean, I have always been one to say that you do what suits you and what you have a passion for, like I mentioned a bit ago. I don't think necessarily inherently infectious disease is any better than cardiology or endocrinology or GI. But for me and my personality, the idea, I mean, people always asked, why did you pick infectious disease? Well, I'm also an immunologist, and I really was fascinated by the interface between the immune system and protection against pathogens. So that was something from a scientific standpoint. But just the idea that you have a disease that would have an etiology that you can identify, an etiology that you can treat, and an etiology that you can prevent, that is serious enough to kill you so that you can take your job really seriously. So infectious disease fills all of those, just checks all those boxes, that it can be serious enough that it isn't a trivial subspecialty. It has global implications, because when you get outbreaks like we're in right now, it goes well beyond the individual patient, and it has impact on the entire world. And then you also have the gratification. You can have a really, really sick patient. You could treat them and they could be completely well after you treat them. I mean, all of those things I think are very attractive about infectious diseases.
So one of the other questions was about what you're looking forward to the most when we feel that this is managed. I know over maybe hard to say it's ever going to be completely over, but what are you looking forward to the most?
Well, from a personal standpoint, getting my family together I have three daughters who are scattered throughout the country, one on the West Coast, one in New England, and one in the South. I want to get us all together and just have a big hug with each other. That's one of the things I really missed. I haven't seen, two or three of my daughters in a very, very long period of time, and the other one also in a pretty long period of time. So that's the first thing I want to do. Just a family issue. Get the kids together with my wife and I.
Are there any questions that I didn't ask you that you'd like to, or points that you'd like to make to this audience tonight?
Yeah, it wasn't necessarily a question, Judy, but one of the points that I like, particularly because I'm very sensitive to the fact that, particularly for college kids, if you want to call them that, but they're not kids anymore, but people in college, you've had a terrible disruption of your life at a time when most of us have had, a different experience in our fourth year, where you enjoyed to the fullest the life of the college, which that's been taken away from you. And I feel really badly about that. But, what people have shown is an incredible amount of resiliency. So I always say, when you're dealt with important challenges, you often come out of it better than prior to the challenge. So even though you've been deprived of a classical senior year that many of us have experienced, I think there's going to be some interesting advantage of it, of being able to have survived this, gotten through it, and you're going to be a stronger person for it. So I'm sorry you had to been put through this, but you're going to be better off for it in the long run. And it will end, and we're all going to get back to normal. That is for sure. I'll guarantee you that.
I think we're all looking forward to that. And are there any, any particular things that you do differently next time around? If and when, and I suspect there will be a when, we are faced with a pandemic like this again?
Well, the one thing I do hope, Judy, and it isn't necessarily anything I would do different, is that we have been in an unfortunate situation where we've gone through a historic pandemic, when our country has gone through a degree of divisiveness, the likes of which we haven't experienced in memory. I mean, in decades and decades. We've always had political differences, but we've never had the just frank enmity between individuals, where you really almost like we're fighting a war and we're shooting at each other. I always say that virus is the enemy. It's a common enemy, not each other. So I would hope that next time around, that we look at it as we've got to all pull together, instead of being at each other the way it has been, like it or not. You could deny it, but it's undeniable that we've lived through an extraordinary period of divisiveness, which has not been helpful when you're trying to essentially mount a response against the deadly pandemic. So next time around, I hope we don't have any more pandemics, but history tells us we will. And if we do, and when we do, I hope we can pull together as a community, as a country, and as a planet to get through it together and not be fighting with each other.
Any advice to share about how to do that? I mean, I know you've been in, you've worked in situations where there were differences of opinion, but, as a leader, how do you help bring people together or bring them to a common goal? I think that you've certainly been someone who has brought people together towards the common good. What worked for you that you could share with us?
Well, one of the things is, I jokingly say it comes from one of the famous lines from the Godfather. It's nothing personal, strictly business. Don't take things personally when people are attacking you, and try and get down to continuing to reach out to them, even though it looks like they're essentially attacking, and try and get to win them over by being open-minded and flexible with them. I think if you propagate the hostility, it's not going to go away spontaneously. You've got to diffuse it by showing you're willing to extend yourself to people, even though they act in a way that anybody could interpret it as being hostile to you.
I think that's great advice. And one almost last question was, looking back, if you knew back when you were in college what you know now, what, if anything, would you have done to prepare yourself for this pandemic? There was actually a question about what courses would you have taken, or what types of preparation do you think people need for going out into the world? What advice do you have about that?
Judy, I wouldn't really have done anything different. I had a very unusual training, and I think that really did essentially position me well to appreciate and to respond to all of these differences among people. I took a classics philosophy background in college. I took just enough science courses to get into medical school, but I was a Greek, Latin, classics, philosophy major in college. And I think that really did train me for all the stuff we have to go through. So if I had to do it over again, I'd do it exactly the way I did it.
That sounds like great advice. And there's so many comments here in the questions of people thanking you for your service to our country, to your leadership, people who are sharing about family members that knew you. There is one I do want to share with you, and that was Frank Polk, who was a pioneer in AIDS. And it's Frank Polk's daughter, Genevieve, who's a member of the Bowdoin class of '99, and she's currently working in public health, keeping the Polk legacy strong, and wanted to thank you for everything you've done. I just thought that was really terrific and want to share that with you.
Well, thank you, Judy. Thank you. Frank, as you know, we lost prematurely, but he was a terrific person, part of a really great effort.
Thank you so much for being with us tonight and sharing your personal views. It's been an absolute pleasure to talk with you. I really appreciate your insights and sharing so much of your personal story with all of us tonight. And on behalf of everyone here, thank you for your service to our country and our community. Thank you all for joining us tonight. The next conversation for our honorary degree recipients will be next Wednesday, May 26th at 6:30, and it will feature the NASA astronaut and Maine native, Dr. Jessica Meir, and Alvin Hall, class of '74, an award-winning BBC broadcaster and educator, will host the conversation with Dr. Meir. So thank you again for joining us tonight and being here for this conversation with Dr. Fauci.
Thank you, Judy. Thank you for having me. Real pleasure.
All right. Good night.
Good night.